So before we start, I will ask you a couple of questions, just an ice break. So do you know which is the first car brand in the world? Do anybody know about it? Especially the guys who are more into the cars and these things. Which one? Mercedes? No.
It's Ford.
Yes, correct answer. It's Ford. Okay, and regarding the tissues, for example, do you know which is the first brand in the world? Sorry, I skipped one. It's okay, just you can tell me. The tissues, do you know? Everybody knows about this. No? Kleenex. Kleenex. Everybody says Kleenex, even if it's not, if it's different brand now, because it's the first brand which was produced in the world, Kleenex, so everybody say Kleenex. It comes to the skincare, which is the first brand in the world? You know? Suggest anything. Which one? Cetaphil? No.
Nivea.
No. But it's related, the same company. No. We are in which training, guys? Which product? Yes, it's Eucerin. Eucerin is the first brand in the world which was produced actually as a skincare product. I will tell you the. See, it's a little bit mixed. I will tell you more about this. Just a quick information about it. Before it was produced, it was called Eucerit, not Eucerin. I will tell you what Eucerin means. Beiersdorf is the company behind Eucerin. It's a German brand, so it's a German company. It's the owner of all these brands. Many of them are available also here in UAE, and for sure you use them. Everybody have something Nivea for sure. And also Lapello, the lip balm, also Florina, Hands Plus, the plasters for the, and Eucerin. So Beiersdorf owns all these brands. Eucerin was the first one which was invented, as I mentioned before, by these professors, Professor Paul Beiersdorf, where is the name of the company comes from, and the Professor Paul Gerson, Professor Oscar, and also Professor Isaac. First, it was invented in 19,000, so it's long time back. The company itself was made or founded in 1882. Then the first product came in 19,000, the Eucerin. Then this is the evolution of all the brands through the years. So you will find, for example, one pH 5, for sure you know also in the ranges, there is pH 5 lotion. This came out in 1970, for example. You have the sun protection. It was first launched by also Beiersdorf, not other companies, in 1991. For sure, you know the Hyaluron filler range. It's very famous within the ladies specifically. So it was invented in 2006. And it comes again, our patent, now it's 2019, which is thiamidol for pigmentation. So through all the years we invented, it kept in working on the ranges itself. So what is Eucerin? Name comes from. What's the meaning of Eucerin? Eucerit, this is the first name, the previous name. Eucerit means the beautiful wax. It's a Greek terminology. It means the beautiful wax. And this is why they call it like this beautiful wax, because they are the first company who made the water, the first one who made the stable oil emulsion, water oil emulsion. So the Beiersdorf itself was the first one to invent that. That's why they call it the beautiful wax. So it was the number one brand in the worldwide. For example, Aquaphor range, it was very famous everywhere, USA, Europe. This one is the best for all dermatologists actually, especially for the cracked skin and also the dry skin. It's changing a lot. You know the urea. Our urea, many brands actually in the market are having urea, but our urea have the gold standard in Germany. And also it comes to the patent for us, the thiamidol range, which is the pigmentation range. We will go through the ranges one by one, but let's take first a look on that. Why Eucerin? Why I will recommend Eucerin? This is really important. In the market, there are many competitors, many competition, especially in the skincare. People are confused. The social media is also playing a role nowadays because they see some video, then they run to try and try. So I know that it's really hard to convince a consumer to buy from you. Also the online offers and all these things, I know it's really hard. But how to convince them? This is what we will work on today. So Eucerin, it's usually, this is our slogan as well, that we believe in that the skincare is not just a luxury or something new. It's a life-changing products, or it's a life-changing, let's say, treatment for the patient, because we will see why as well. I will just show you, I will show you this video, then we will continue. Matish, what?
A lot more to have negative thoughts about who you are. When I got kids, I was very worried and rushed. In my early 20s, I had I started moving to Dubai. I realized there's not all day long and all year long. I had damages on my skin. I was acting all my life. I was always put the kitchen off. A lot of days I just want to rip my it was a nightmare. I was 1 year old. He got burned. I asked his aqua. So we applied for on his forehead. I got very loud about all the now and what I do, I use Eucerin sun oil control. I don't need to wear it more to have that small. Eucerin changed not only my life.
So as you see that the skin problems have a very big impact on the person himself, on his social life, on his feeling comfortable. You heard in the video they are seeing feeling comfortable, feel more, let's say, strong, impactful, enjoying the life, for example. So that's why skincare is really important, and that's why you will see the patients, they are coming to you ready to pay like fortunes for skincare, but they will not pay, for example, a co-payment for something which is a big life-saving, for example. You got my point? So, and here also we are able to get money, right? At the end, we are all working for the sales. So that's why we are believing in this. It's a life-changing, because you will see also that it can reach to suicide. You got my point? So what the ranges that we are offering in Eucerin, mostly we are covering all the skin problems, from acne to pigmentation to dryness, sun protection, even for babies and for adults. We have some products for babies. The most prominent or maybe well known by the patients themselves is the pigmentation range, because it's patented only for Eucerin. No other company can use the active ingredient. Only us. We're having another range also for which is the hyaluronic filler for the signs of aging and quality of skin. So mostly, for sure, you can at least sell one item, which is you will find, I mean, what the patient needs in Eucerin. So today we will start with the acne, because nowadays even it's the season for the acne patients. And it's really important. And also the competition is very high in this one. All the companies, I believe, all the dermo-cosmetic companies, they have something for acne. So you will find that the acne patients, it's really prevalent worldwide. It's number 8 problem, which is prevalent. It's the number 8 in the world, prevalent disease in the world, okay? And it's 9.4% of the world populations have acne. You imagine? And see the number, 730 million person have acne in the world. So really, these numbers actually is by WHO. So it's really prevalent. People suffers. The confidence, the lack of confidence which comes behind the acne is really big. So the people are coming ready to you to find a solution. Okay? So actually, we will go through the range now, but before going through the range, I will take you a little bit refreshment about the acne process, how acne comes, and the type of the pimples and papules and these things. So basically, acne happens, all the stages of acne, from the mild one to the severe one, the inflammation is part of this process. It starts with inflammation, even if it's not visible on the surface. Even there is no redness, no itchiness, but it starts with inflammation. Okay, then after that, it comes the bacterial growth. So the bacteria, there is a media, the sebum. This is the sebaceous gland, if you didn't see before. So in the sebaceous gland itself, the bacterial growth, when inflammation happens, the bacterial growth also increases which leads to more inflammation. Okay, then the blockage step comes. The pore itself is blocked with something called hyperkeratosis. Okay, then it comes the excess sebum production inside the gland itself. When it's blocked, the sebaceous gland is working, so more sebum is coming out. So here comes also the acne itself. It starts to appear. So how to manage these steps? also we will know about it. So in the acne people, you will find that 44.2%, by the way, this was in UK, 44.2% of the people who have acne were bullied. Okay, so that's why it's very impactful on the patient himself. And 86.3% have anxiety, okay, and 18.5% of them, they have depressive disorders, and 2 to 3 times more frequent patients having idea of suicide. So it's really serious. It's not just a skincare. You got my point? So this means that it's really impactful, and it's really important to give them the right product to trust you as well. So the acne is not only happening for the teenager or the smaller age. No, acne happens, yes, in 80% of the teenagers, but also 40% of the adults can get acne as well. The acne also is not only in the face, it can be in the face, in the body. So I will take you now through also we did this one. So who can tell me the difference between the blackhead and the whitehead, for example? Which product is suitable in this case? You know the concept behind the disease itself, or the problem which the patient coming to you to just take your advice about it. And already you have many products in the market which having different acids, different composition, different combination. Also marketing, marketing slogans from everybody. They are saying we are good, we are good, we are good. So how you know it's really good and it will really work for this patient? It's personalized for him. It might work for this guy, but it will not work for this lady, right? So if you know the disease itself, if you know what happens with the patient, you will be very confident and you can recommend easily which one is really suitable for him. And you can even you can use different products together, not even the same brand. It's okay. So let me take you through the types of the acne, or the steps, let's say, of the acne according to the severity and how it appears. So as Dr. Amr was telling, there are many types. There is a blackhead, whitehead, pimple, papule, pustule. You will hear all these terminologies from the doctors everywhere. So let's say the blackhead, it's like a small dark block. There is a block in the sebaceous gland, as we mentioned. So it's a small dark flat. Also, it's not above the surface of the skin. It results how the sebaceous gland, when it's clogged, the sebum, which is on the surface, it's oxidized from the oxygen, so it gets the black color. That's why it's having this black color, like here in this photo. See, it's not raised on the surface; it's just a black color discoloration. But the whiteheads, as you see here in this photo, it's a little bit raised, okay, on the surface. It's round and blemished and have the white milky color, okay, and it also results due to the blockage of the sebaceous gland. And it is a type of the pimple, but it's still in the first stage, still in the beginning. Little small white heads. The pimples is the inflamed. It's more, it's more severe now. It's an inflamed and raised also blemish that is having pus inside. So you see here, for example, in these areas, there is a pus inside, and for sure there is inflammation. Okay, sometimes it's painful. Okay, because there's inflammation and pus. It's really hard to some people when it goes to the very severe patients. Some people have very severe acne. They even cannot touch this acne itself. The papule, as you see here, is also, there is inflammation as well, and also raised above the skin. It's elevated above the skin, but it doesn't contain any pus. Not like here. You can see here the white heads, but here nothing. It's hard and it's raised. It's red, but it's not no pus inside. Okay. You will not go through this with the patient himself, but you also should know about it, okay? The pustule, you can see here, it's a little bigger in size for sure, and also bigger in severity. So it's larger in size and larger in severity. It's inflamed with pus as well. What is the acne marks? I don't know why here. I don't know if you can see here. It's not visible. Anyway, I will tell you, there is something called post-inflammatory hyperpigmentation, or what we call it PIH. This one is the pigmentation or discoloration which happens after any inflammation, any kind of inflammation. So mostly, as we said, and as we mentioned before, that Inflammation is one of the main predisposition of acne. It's always there. It starts with inflammation, then it grows. So due to this inflammation, if it's untreated, what happens? Melanin production increases and discoloration happens. Maybe for psoriasis people, maybe for acne people who are not treated well, many things can lead to this discoloration, okay? So there is something called IGA, which is the Investigators Global Assessment. This is like an assessment done to know the severity of the acne. So it's making assessing the patient into these grades, 4 grades, 0, 1, 2, 3, 4, 5 grades. Sorry. So again, as we mentioned, acne people are really sensitive. They are coming to find a solution. So they don't want to and it's really, as we said, there's inflammation, so you have to be 100% sure on the concentration, for example, of the molecules which is available. It might increase the inflammation, right? So as a reminder, it's really impactful for them, for their psychology, for their confidence. So you have to be sure. Let's talk about, this is a survey done between the people who have acne. They found that 78% of these patients are really cannot even use social media or take photos. They are using filters. Everybody is using filter now, but also these people are really, really sensitive regarding the socialization. So 87% agreed that they have a problem. Okay, so let's talk now about the ingredients. We already spoke about the problem itself, which is the acne and how it comes and what are the factors which affect the appearance of the acne. Now we will speak in parallel the ingredients which are suitable for these problems. You mean a complaint from the patient, huh? What you offer, okay. The cleansing gel, okay. Thiamidol, okay. This one will suit some people, but not everybody. We will know about it, yeah. Sunscreen is the number 1 in the world, the oil control, actually. I will take you through the range, but we need now to speak about the ingredients itself, which is suitable. These ingredients might be in Eucerin, might be in other companies, but not all as a combination. So we already know the process of the acne, how it comes or how it appears. So for sure, there is a cycle, right? We spoke about the surface, the clot which is on the surface. We spoke about the inflammation, and then we spoke about the marks. So salicylic acid, for example, this is an AHA acid. It's a small lipophilic molecule. Okay, it works on the surface only. It's like an exfoliation. It depends on the concentration itself also. Some people say, for example, all the doctors all know that salicylic acid in lower concentrations, like 1 point something, it's only anti-inflammatory. It's not exfoliating at all. But in higher concentrations, it's more exfoliating, okay? And also it's having antibacterial properties. As we mentioned, there is bacteria. It's a good, inside the sebum, it's a good media for the bacteria. So also it's having antibacteria. So now this one is treated. Also having exfoliation, so the clog already is open, the pores are open now. And then it comes also the Leucocalcone A, another ingredient which is having anti-inflammatory properties to soothe the inflammation, okay? How it do this? It works on the inflammatory mediators, we call it, the cytokines. So there is a cycle for the inflammation to happen. It stops this cycle. That's why the inflammation is reduced. Then it comes to the marks, the PIH. We have the thiamidol, as you mentioned. So the people who don't, for example, have pigmentation, they have acne only, they will not benefit from thiamidol, for example. But they will benefit from these two ingredients. That's why we have different SKUs through the whole Dermopure range. Something having thiamidol, something not have thiamidol, okay? So thiamidol, how it works, this molecule is our patent. It's only for Eucerin, as I mentioned before. No other company can use it. Thiamidol is the first human tyrosinase inhibitor. We will go through this later on when we speak about the pigmentation range, but it blocks the melanin production. It stops the melanin production. That's why the pigmentation is improved. So as I said before, there is salicylic acid. The salicylic acid, I mentioned that it's BHA. So we have something called BHA, AHA, and PHA, different acids. What's the difference between these acids? The beta hydroxy acid, as I mentioned, it's a small lipophilic molecule which works only on the surface. So its main target for the exfoliation or cleaning the surface itself, the dead cells and the clog, which is happening. And it's oil soluble, as I'm lipophilic, it's oil soluble. But like the salicylic acid, which we spoke about. But what about the AHA? The AHA is more inside. It goes inside the pore for the cleansing itself, like the glycolic acid. It cleans the pore from inside because, as we mentioned, sebum production is too much and it was clogged. So we need to clean the pore, otherwise the block will happen again. And the polyhydroxy acid, this one works also on the surface, but it's like balancing the dehydration that might happen because of the other acids. So sometimes you will find the 3 acids in the same product. Yes, it can happen, but the concentration also varies. Okay.
One of the questions you might all ask, do we need to memorize the all? Can you please have it silent? Why do you do that? Why? First of all, most of you are pharmacists or working in the pharmacy with the ingredients, super fun. So, and we would love to know what is inside it, and then how it acts and why it makes it different from the others. Because if you tell me this is the best thing in the world, prove it.
Yes, definitely.
So how can I prove this if I'm not saying that it has an alpha drugs inside, which you can use it and it can work right, but because feelings otherwise. So understanding how it works will give you even the possibility or the potentiality to work on a.
You will know the features about the product itself. Yani for sure.
I asked about
Yes, ingredients is really important. Specifically, as I mentioned, there are competition in the market is very high, especially in the skincare. Yani every day there are new products are coming to you, right? So how you will differentiate to the patient if you are telling, and how he will trust you? He should find you knowledgeable. He should know that you know what's inside, what you are giving me, right? So that's why I know it's a lot, but you will find these ingredients repetitive in most of the products, so it's easy. So I will speak now about our range, which is the DermoPure that you are aware about. It's available. We start usually from the first step, which is the cleansing step, till the last step, which is the sun protection. We have all the steps inside, even treatment, the moisturizing. Every range have its own products. So it's really easy for you. For example, if you are receiving a patient who is oily skin or having acne, or to find all his routine in this range. Okay, skip this one. I think some of you see this range is new for him because before it's a new look actually. It was a lighter green and it was a very long name, Dermo Purifier, for example, the rest of the SKU. But now most of you, I think you received already in the pharmacy this new packaging. The active ingredients of the range is the same, no change at all, but only like a new look for the range from the main company. This is the full range that we are providing in DermoPure. We are having for the face and the body as well, for body acne. We will speak about the difference between each SKU, when you will use this and when you will use the other. Let's go through that. Okay, so usually the main ingredient which is available in the DermoPure, since it's for acne, for sure there are the acids, which is the salicylic acid, is any AHA or BHA, beside another ingredients. It depends on the formula itself. So we are having 2 cleansers in DermoPure. We are having one, which is the normal one, which I will show you here. This one, for example, DermoPure Purifying Cleanser. This is the milder form or milder cleanser. It can be used by even if no acne, for example, oily to combined skin. They can use it as a daily wash. It's fine. It's having also the salicylic acid inside, 2%. It will clean. It will do all the steps of the cleansing. There is another more higher in concentration of acids, which is more intended for people who need real exfoliation. They have the pigmentation. So they have acne and inflammatory pigmentation also together. So this one have BHA, AHA, and PHA. So total composition, total percentage of the acids is up to 10%. So it's really harsh for people who cannot be used, for example, with people who are using drying agents like isotretinoin or any topical, even drying agent. So the people who are using these molecules, they should go for the milder form. People who, for example, the teenagers who still didn't start, any oral treatment or topical treatment, they can go for this one. But really make sure this one is specifically to be given to the right person. Otherwise, it might be a little drying. Okay? We have a toner as well. The toner is only used to prepare. Yeah, this? Yeah, it can be used. For sure, it depends on the patient. You are the people. If he's coming asking your advice, you will assess him. If it's too much severe, it needs real exfoliation, he can use it daily. Some people are not having too much severe acne, so they use it only 3 times per week. So it depends on the patient. You cannot put a rule for everybody. They can use it. Specifically, if they are not using any other treatments, they can use a daily wash. It's even, by the way, it's not drying, but for people who are using other drying agent, it will be for sure drying, because he's using many things together too. He will be dry of sebum, totally dry of sebum. So here, if he's using alone, the PHA, as we mentioned before, is balancing the dryness that might happen because of the other acids. So intendedly, they put this here to balance. You got it? So you will personalize the treatment for everybody. It's different, okay? Okay, we're having also the toner, as I mentioned. The toner having also acids. Some people use it to prepare the skin for any other treatment they are using. It's just a preparation, and also you can consider its type of treatment because it's not. They will not wash it. The cleanser at the end, it's only intended for. It's a cleansing step, only preparing also the skin. It's not a treatment because it will stay on the how long it will stay on the face. You are washing and then it's removed. So the preparation is important, but what comes after is more important. Okay? We are having a serum which is called the triple effect serum. This one you consider it as the treatment. This is the treatment for people who are having acne and pigmentation from acne. Okay? Which is the PIH. It's having also combination of acids, but it's having the thiamidol. So thiamidol is not available in any of the previous ones, but available here. Whenever you find the triple effect, it means it works for the acne, the pores, blackheads, and pigmentation. Whenever it's triple effect, so it's more advanced. But if there is no triple effect, so it's for normal people, even people who don't suffer from acne, but they have oily to combine, they can use. Some people are using the serum on the entire area, on the entire face, and others, sometimes they are using it only localized on the acne itself. It depends on also the patient and the severity, if it's too much or only specific area, or some people get, seasonal acne breakout on the skin, so they need only something, they have an occasion, they need something only immediate action, okay? So it's really safe and they can use it. People sometimes use it daily, twice daily even. It's okay, safe to be used even before exposure to the sun. But it depends. If for example, if you see a doctor, he prescribes other medications, sometimes people prefer to make it one time only at night. You can go take it safe, put it at night. But the best advice for people who will use this too, after applying, because it's it's like a serum, but it's yellowish color. It's giving the glassy skin, so they will feel like they are lifted, So they have to apply moisturizer after it. Yeah, and make sure that the moisturizer that you are giving to the patient specifically for this category is a water-based moisturizer. It should be. Other than that, if you use another type of moisturizer, it will be comedogenic. It will give more breakout. So we are also providing this in the range. You have a cream which is called, before it was called adjunctive cream. Then in the new packaging, it's called Hydra. So from its name, Hydra, it's for hydration. 100% intended for hydration. It's having something called sensitive as well. It's not only hydration, no. Sensitive also, it works on the inflammation. So it will reduce the inflammation. Okay, it works on inflammatory mediators. We are having for the body, you will find this, the body acne is the worst. People usually they neglect this area totally. For example, for the back, for the hands, there is another case which is called keratosis pilaris. We call it like the strawberry skin. So these people cannot find solution. They are neglecting to treat this problem. Then they come when it's already too much, you know. So you will not find competition in the market in this. We are the only one, I believe, which is, I mean, dermocosmetic giving the body acne. It's really good impact. Really good feedback about this one. It's also exfoliating. It's having acids. It's having also the thiamidol for the hyperpigmentation. It works really magical for the keratosis pilaris and the body acne. So you can recommend it really safe. And also it's hydrating. It's a cream form, so it's also hydrating. Then it comes after that the sun protection, the oil control. I will tell you in the later. We will speak about the sun protection separately because we are having different sun protection. We are having now new launches for new SKUs. It was not available in the market. We are having something called mattifying fluid. The mattifying fluid, some people who are having really oily skin, they need something, especially the ladies who are putting makeup, who are applying things on their skin, they need to feel this matte effect. So we are providing a fluid, which is mattifying fluid. It immediately...
Usually people with oils, you'll have the shiny look.
Yes, the shiny.
You need to move because the shiny look doesn't look good with you. When you do makeup, if there is an oil...
Greasy, they feel greasy. Yeah.
Absorb all that.
Yes. Different molecules. There are different molecules, definitely.
Let's stop and absorb the water and to look shiny and to add more
layers of other. There are, as the doctor said, yes, it's the shiny look or the greasy look. It's not only about the reflection of the light or the shininess. It's sometimes if he's really oily skin, it melts. Especially in here, the weather is mostly hot, so they don't like this sensation for sure. So the composition is salicylic acid for sure and carnitine. So salicylic acid is in all the range. Definitely, even all brands, every brand in the world which is intended for acne people, for sure you will find acid. Then it comes the difference between each product, the other ingredients which is added. Okay? So it gives it controls the oil or the shininess for 8 hours, up to 8 hours. Okay, so they like it very much. This is the Hydra, which I call, this is the new look of the soothing cream. So this is the emollient. It's a water-based. It's really good for even people who are using isotretinoin. It's really good. It's a water-based emollient, very light texture. So this is the most suitable hydration for acne people or even combined. Okay, you can give it safely. This one, it was there, but it's not available yet. I will not go through this. Why we did the new look? And just to mention, they are most of the world now are they speak about the sustainability. They are really trying to take care of the environment. So also we are going with this direction. So the bottles which we are using, we are trying to reduce the microplastic ingredients. That's why we are using new packaging. It's more environment friendly. But as I mentioned, the ingredients are the same. So you can give to the patients. So, okay. So we already went through this, the triple effect range. So we have now 3 triple effect products. Triple effect, we have the cleanser, we have the serum, and we have the body. So you will find in the pharmacy 3. Mostly, as we mentioned, the main ingredient, salicylic acid with thiamidol. So we will work on the acne itself, okay, the clog itself, and the pigmentation which happens with the acne. Okay, for the body and for the face. So it reduces the pimples by 66% and reduces the acne marks by 80%. It's really a big percentage. And also the comedones. The comedones is the clog or the acne or the pimple itself. So you imagine the percentage. So definitely you can be 100% confident that the patient will come back to you with a happy feedback. Just to remind you about the Leucocalcone A action. So what the cycle, if somebody can recall now and tell me, what is the cycle of the acne to happen? What's the predisposed? Yeah, tell me. Sorry? No, I mean the factors which affect the acne. Like, I give you a hint. Inflammation and, okay, and the clog, yes, and bacteria, right? So so the salicylic acid works on what? It's just a quiz, huh? A quick quiz. On the surface. Salicylic acid on the surface, exfoliating. Okay, and the thiamidol, for example, pigmentation, for sure. This will come also not only in this range. We have a full range for thiamidol. It's number 1 globally. So this we will speak more about the thiamidol later. Leucocalcone A, if you remember, because we spoke a little about that. Inflammation. We worked on the surface, we worked on the pigmentation, so only the inflammation left. It's the leucocalcone A. Leucocalcone A is available in most of our products, by the way. We also will come to this in the other ranges. I will not take you through the studies and these things, but these are, I'm not so sure it's visible here or no on this slideshows, but these are a real case, okay? It should be the improvement of the pigmentation itself. You see here the darkness, this darkness is the PIH, which we were speaking about. So this patient used the triple action range for 12 weeks, okay? They suffer from post-inflammatory pigmentation. It was, as you see here, still even some acne are still there, some breakouts are still there. So this is the baseline before using any treatment. Then after 2 weeks, it's a little bit starting the improvement. Usually we are saying that thiamidol, they will start seeing any visible results after 2 weeks of use. So after 2 weeks, after 8 weeks, and after 12 weeks. If you compared here and here, you will see a big difference in the darkness. But still, the commitment is really important. It's not really visible here, but it's totally different. Here also, maybe this is... you see the inflammation, for example, this as a factor. The inflammation is more reduced, the redness itself. See this area? So while using the product, they are getting more clear skin. The commitment and the number of application is really important for any product. Any product you suggest, even not Eucerin. It's really important to tell them the right times of the application and the patient to be committed. So if somebody, for example, coming to give you a feedback, you gave me this product and I didn't get any results. It's not good with the product. Should I just believe him like that blindly? No, I have to ask him. How many times you applied? Did you use other thing with it or no? You put morning or night. You have to get from him more information. Don't just take it blindly and say khalas and believe it's not a good product. There might be something behind. Okay? So usually the routine for any patient, especially for any patient, not only the acne people, it starts with the cleansing step, the treating step, and protection. The cleansing, just preparing, as we mentioned, is the preparation step to control the excess oil which is there and the exfoliation, giving a little bit exfoliation. Then the treatment itself is like the medicine that you are giving to remove this problem, and the protection from the sun. Because the protection is also really important. You will see this later when we speak about the sun damage which happens. So this is more information a little bit about the hydration, which is the Dermopure Hydra Repair. The hydration, it's a study actually, which we conducted about this product. You will find even after using this emollient for the acne people, it's not only about the moisturization, it's also about the reduction of the redness, of the inflammation. So it's not. So what's the difference between this moisturizer and any other brand? It's not only moisturizing; it's also treating. It will enhance the effect. So it's really good to give. If, for example, if you are giving the triple effect serum, to top it up with the Hydra cream. Okay. Definitely. Most of the acne people have, as we mentioned, the inflammation is the starting point of the appearance of acne. So for sure, yes, definitely the percentage, as I mentioned, the percentage of that's why we said that the triple, for example, the triple effect cleansing gel is not suitable for all. I told you this, specifically this SQ, you have to be cautious when you are giving, because it's intended to make more exfoliation. Is for the people who have too much keratosis and we need to remove, specific, yes. Here comes your knowledge about the product. See, as he was asking you, should we know the ingredients inside the product? Here comes your knowledge. You know that this one will not increase. Here you can convince the patient with this, because you know that this one it will not increase the redness, it will help to reduce it. You got it? And you know the percentage of the acids which is there, so you can guarantee 100% that this one is not harmful for him. You got it?
treatment of acne. Maybe everybody they thought about I have sensitive skin, that's fine. So everybody will think you need to check this by what item you're using and what you used to have when you have irritation, what kind of irritation, what kind of redness. When it comes to treating acne, any exfoliating, any peeling treatment, it has to go through regardless because you are treating, you are removing a dead layer or a skin layer. Once you remove this, definitely you have the redness. That's why there is a complementary treatment with it. That's why when we give this, you will take this. Because at the beginning you will feel a redness, a tightness. But to overcome this, we need to have the moisturizing in the morning, we need to have a night cream or a serum that complete.
Exactly.
The way we are saying it, and the way we give this
The information, yes, exactly.
And you need to understand that nothing will do catalytic or peeling will not.
See, if anything exceeds, exceeds its limitation, it will make a problem, right? So, as he mentioned, you should manage the expectation of the patient also. If you give him all the information in the beginning, he will feel safe. Even if you give him let's say, what's he suspected to happen. For example, for people who are using retinol, most of the people, many types of retinol, we put, I have a breakout, right? But everybody knows that retinol works from deep inside to outside. So in the first few weeks, they will get a pimple. They will get acne. Then later, it will disappear. So they couldn't judge the product from the first application. And some people, they say, we are sensitive skin, right? But sensitive, they might not be sensitive. They might be using wrong products, okay? And also let's agree that all the products which having acids, especially if they are having, for sure, if they are having acne and breakouts, sometimes there's be also like scratches or something in the skin. So for sure, when they apply, for example, acid on a wound, it might give a stinging effect, okay? By the way, in the Hydra, also I didn't speak about the more ingredients which there. We spoke already about the Semstif, which is anti-inflammatory, so it will reduce the inflammation. It's having also ceramides, so it works on the skin barrier itself. It's repairing the skin barrier, so it's really, really a good moisturizer for people who are having oily skin. It's having also the Lycocalcone A, which is also supporting the anti-inflammatory action, and it's having a little bit of glycerin. So as we mentioned, the acids might cause what? Stinging effect. So how we will balance this with the Semstif? When they apply this Hydra after the acids or for example, the triple effect serum, if they apply this after 97% reduction of this sensation because of the Semstif, because of the mode of action of the Semstif, okay? So this is a cross-selling. You can, for this patient, you will give two. You will raise your sales. This is a real also patient. This is like a clinical assessment. You will see this. This is the baseline before using the treatment. The patient it's really visible, the dehydration. Even see the peeling which is happening here. Okay, and this is after only 2 weeks of the use of the Hydra. See the shininess of the skin, and it's more radiant. I will not go through the Hydra too much. Let's step. Let's talk now about the body a little bit. The body, it's called Dermopure Correcting Body Care. As we mentioned, this is intended for people who are having back acne, body acne anywhere, or having keratosis pilaris, any kind of pimples. They need something which exfoliates but also hydrates at the same time. So it's having salicylic acid, it's having thiamidol, and it gives also hydration because it's in a cream form. It gives also hydration for 48 hours. So it's 3 in 1. It exfoliates and hydrates. Some people who might have a little bit sensitive skin, they might see the exfoliation itself or the peeling. If they need to top it again with another moisturizer, if the peeling is too much, they can do that. It will not be comedogenic, it's fine. But mostly they will not need to do that because it's already hydrating. But in case this happened with these people, they can use also a hydrating agent. Okay, let's now talk about, this is the old formula, all of us aware about it, and this is the new look. By the way, there are big size now also launched this year. It was 200 ml, now there is 200 and 400 ml. The cleanser can be used, the 400 ml can be used for the face and body. So for people who need, for example, a medicated cleanser for the body or like a shower gel, they can use Dermopure range, the bigger size. Even you will see on it, it's written face and body. And this is the triple effect serum, the old one, and this is the new one. I think the new one, it looks much better, right? And the toner, this is the toner, the new one. It's even more easy for you, the new packaging, in my opinion, because they write the ingredient itself, it's really visible here. Before it was, see, they don't mention anything about the ingredients, you will only find it in the backside of the label. But now it's really visible for you and for the patient, even as a memorizing, when you are recommending for the patient to find or remember from the active ingredients here on the the front face of the product. The scrub, this one was available in UAE long time, then it was discontinued for some time, it was out of stock, then now it's coming back in this form. But we have really good feedback about the scrub. This is the mattifying fluid that we spoke about for people who don't like the shininess. Specifically, you will find these people mostly are women, because they are they need something to control the sebum or the shininess before applying the makeup. So you can give this one. Okay, it's having carnitine and salicylic acid. Okay, the Hydra, also the old one and the new one. Usually they write here the main ingredient, which is the treatment or which is different than the others. For example, they will not write here glycerin, for example, because it's not an important ingredient, but you will find the key ingredient written in the front side. Semstiv. When you see Semstiv, it's inflammation. This is the triple effect cleanser, the new shape as well. This one is, as we mentioned, it's only for people who need too much exfoliation. It's up to 10% acids, so take care with this one. Cannot be used with any drying agent. Okay, so this is just a reminder. The products, the oily control products that you hear it from the patient coming to say, I don't like this product because of X. So what's the most prominent problem you want to say? Yeah, because see, there are causes for the acne for sure to happen. So to prevent totally the appearance of acne, we need to prevent also the root cause, right? So this is totally different. Now we are speaking about the surface. Now we are speaking about to manage the sebum production. But for sure, in the cases of like hormonal acne, we need also to stop this. So it will be together, like a regimen. You got my point? For sure, you will use a topical or you will have a special routine, but you have also to balance the hormones. So this is really different. Yes, you definitely, especially for the ladies. That's why we all know sometimes there are sudden breakouts, so they need something now because it happens now. They got one pimple before the occasion, so they need something now to put it to let it disappear. Okay, so let's get back again to my question. What's the main complaint about the acne products that you are hearing in the pharmacy? For sure, here they are coming to tell you, you are now giving, for example, this product, and they are saying, no, I tried before, I didn't like. So why they will not like an acne product? You have an idea? You heard any complaint? How it's not working? The acne didn't go, you mean? No, not the most relevant complaint about the acne product. But let's go through. The most prominent complaint is the dryness. Sometimes they go too much harsh in the acne products and putting too many products together that they get dryness from he's changed now from a excess sebum production to a dry skin. So here comes the balance. So for sure here, as he was mentioned, there are steps. You have to take care of these steps. Okay, otherwise it might be a problem. You have to ask, the probing part also is really important. You have to know what he's using. So you can give, if you are giving an extra product, he will stop this or no. He will stop the one he's using or he will use altogether. This all will impact his feedback regarding your recommendation. So that's why you need to know from him what exactly his routine, what exactly he tried before. He might tell you, I didn't like this you are giving him, for example, this cleanser, X cleanser. I tried this before, I didn't like. So why you didn't like? Asking questions will let you know. You can shift him from this to the other one easily. So you didn't like this because X, because it's making for you dryness, for example. I have another one which is having this PHA, for example, which is balance the dryness. So for sure it will not be a drying agent. Or it's a mild, for example, form of cleansing. You can handle his objection. Okay? So I will not, and you can go now for the break. Later, after your break, we will speak about the pigmentation range. Okay?